Kirsten, hello.
Hello.
I looked at your daughter's X-ray and CT scan images, and she does have craniosynostosis, as we suspected. The images show that her suture closed early.
Okay.
Baby skulls have openings which we call sutures, which allow the brain to grow. The brain triples in size in the first year, and after that it keeps on growing until they're about 12. Can you tell me just a little bit more about those symptoms?
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They said I should let her cry, that I shouldn't spoil her. But I was sure something was wrong. She's in a lot of pain.
Yeah, she has craniosynostosis, but the shape of her skull is almost normal, which that probably made it more difficult for them to diagnose it. Craniosynostosis is complex and it's uncommon, so a lot of doctors don't really know how to detect it. As the brain grows, it needs to be able to push the skull bones apart in order to make room for it to grow. If there is a kind of reduction in the growth, then the brain is squeezed and it creates intracranial pressure, which can be very painful.
So what are the options?
We need to get rid of that intracranial pressure, and that is going to require surgery.
Surgery? That sounds really dangerous. My pediatrician said it could be fixed with a helmet.
If the sagittal suture hadn't fused, then maybe a molding habit would work, a helmet would work, but that's not going to work now. Every surgery has several risks, and has surgeries especially. Your daughter's healthy otherwise, and that's really good. That eliminates part of the risk. So what we'll do is double check to make sure she doesn't have any heart or lung conditions, which will prevent us from being able to operate.
I'm just really concerned. What exactly will this surgery involve?
2 options. You can go with a traditional surgery, or you can go with a minimally invasive procedure. With the traditional approach, we make an incision from one ear to the other ear going across the top of the head. It's the only scar. It's usually hidden by the hair. After the incision is made, the affected areas of the skull are removed. We create an opening for the brain to grow. We reshape those bones, return them to a normal position, and when we're finished, the incision is usually closed up using dissolving sutures.
This sounds really difficult.
It's a big surgery. It's complex. It requires the expertise of a number of different specialists working together.
If Jenny has this surgery, do we know that she'll be without pain afterward?
There's no guarantee that the pain will go away completely. In some cases, there's a little bit of residual pain that we can control with medication. In some cases, very rare, we need to do another surgery, but that's rare because the success rate is extremely high. It's over 98%. We've been doing this for years really successfully.
Sorry for so many questions. I just want the best choice for my daughter. After all the bad experiences, I want to be sure. So what about the other procedure, the minimal one?
The minimally invasive procedure is usually done when the baby's young, typically younger than 6 months. That's an endoscopic procedure, and what we do is we use an endoscope to open the suture. It only takes about an hour. She would need to be in the hospital overnight, probably can go home the next day. Afterwards, she'd need to wear a helmet for about 6 months to correct the situation. We check it every 3 months, make sure the sutures aren't closing early. It's a simpler procedure. It can be equally successful when the baby's very young.
Okay. Is the helmet painful?
No, it's not painful. It's custom made. The success of the procedure, though, is determined by how frequently she wears the helmet. So after about 6 months, we'd know if it's normal or not. If it's not, the growth is not normal, then we might have to do another surgery. That second time would be the longer traditional surgery. Both options are complex, and we have to work with a team. My team includes a plastic surgeon and neurologist.
This is all overwhelming.
Yes.
How do I decide what's best for Jenny?
It's a lot to think about.
So you're pretty sure she needs surgery. A helmet alone won't work.
She's had fusion, which has to be corrected, by way of surgery. There's no way around it.
Okay. How do I get more information?
Well, you can ask your pediatrician. Let me just give you a pamphlet, though, that has some information about the condition and your treatment options.
Okay. Thank you.
Sure.